Alright everyone, if we're really hopeful, we might hope to see a draft of the healthcare reform bill that the Senate Republicans now are taking a look at. I don't hold out much hope for it, honestly. Honestly, it's probably my biggest frustration with the Republican Party right now. They are doing exactly the same friggin' thing that the Democrats did with the AHCA. Don't you remember that? Nancy Pelosi comes out. AHCA, nobody can apparently get a hold of more than a brief write-up of the draft of the original bill. And she says, oh, you can't read it. You've got to pass it to find out what's in it. And it worked so well. It was so lovely. It's just a wonderful piece of legislation, one that, 60% of the population opposed long after it was actually passed. There was a botched rollout. That is, the website was built by someone who was in cahoots with Michelle Obama, so a little bit of a kickback there, maybe? Could it have possibly broken some sort of ethics rules? Yeah, probably so. Then nobody's going to do a damn thing about it. And so the AHCA gets passed, and we find out that most of the main promises Obama made were a bunch of bunk. You can't keep your doctor. You can't keep your plan if you like it, unless it conforms to a million different federal standards, raises the price. A lot of people who before they had no problem purchasing health care, all of a sudden they had to pay twice as much if they wanted to keep the same level of coverage, or they had to drop down, get something that would only halfway cover them, and they'd still end up paying what they used to pay. A lot of people ended up giving up altogether. They said, well, I guess I'm screwed. I'll just pay the penalty. The one good thing so far that the Republican Party has done came behest of Trump, where he says, okay, we're not going to collect the fine involved. Yeah, because clearly that's become a problem. Dropping that alone really improves the bill because it means that people who don't want to go through the bureaucratic red tape don't have to. And they can always get private plans outside of these health insurance markets. Here's the thing, though. The Republicans are just doing what the Democrats did. In all honesty and in all fairness, they're doing the same thing. Oh, yeah, well, I guess you have to pass the AHCA to find out what's in the AHCA. You're going to end up with, probably, some gargantuan 1,000, 2,000 page long bill. And it's going to be the same shit. And it's not going to actually fix anything. Whenever you get a bill that's opaque, as in, they're stonewalling on wanting you to see even a write-up about it. They'll tell you a few brief elements of what's supposedly in it, but you can't necessarily trust that that's true. Just like Obama saying you can keep your doctor, you can keep your plan, you can, don't worry, the premiums won't rise, don't worry, everything will be cheaper, lots more people will have health insurance, and it'll be wonderful for everybody. Oh, by the way, just ignore the fact that the pharma companies helped me write the fucking bill in the first place. That was the AHCA with Obama. And it was dumb. And it didn't work. And we saw what happened with it. Now the Republicans are trying to do the same thing. And they've got the votes to do it. I mean, they're not going to have any trouble passing the AHCA. It's just a matter of a few people tinkering around with it a little bit. And guess who they probably don't want to really look through it too much? People like Rand Paul, who might say, well, this is no different than the bill we had before. You remember Ryan Care? You remember. The Republicans make their first pitch. This is a little bit of tell for what's going on. They make their first pitch. And what does Trump do? Trump promptly backstabs Paul Ryan, says, oh, that one's Ryan Care, it's still all negotiable. And he refuses to lend his support to it. Now, as another Republican, he realized it wasn't going to be popular, and if he threw his support behind it, it would pass, and it would fall at his doorstep. Any outrage caused by it would be his problem. He's been notable in sort of standing back from healthcare reform despite being bigly as far as pushing it on the campaign trail. Why do you think he's doing that? Because he knows now the never-Trumpers and the neocons in the Republican Party, they're ultimately the ones that have to craft the bill. It's going to be 90% their bill. He may end up having to disown the AHCA after it passes, and it probably will. Unless there's a lot of outcry from people who supported Trump, we need to tell Trump, why the hell are you doing this? Why don't you just have a bill stripping down, getting rid of completely the AHCA, which maintains pre-existing conditions and expanded care for people on their parents' plans? It's a perfectly reasonable fix. Those are the two big things that people actually liked about the AHCA. Nobody even really knows whether they like the rest of it. There's too much of it to read. Even the Senate didn't read it. They didn't get a chance to. At the last hour, 72 hours to go, I am frantically having my staff pour through 2,000 pages of paperwork. They've got bigger things to do. We've got a country to manage, and Obama wants us to read this crap? Oh, I got 40 pages through it and fell asleep because it was boring legalese that I couldn't understand without a couple of Harvard lawyer buddies coming in. That's what happened with the ACA. It's what's going to happen with the AHCA, unfortunately. And it'll be a blot on Trump's presidency. It's not going to make the ACA terribly worse, because it would be hard to do that, let's face it. But it's not going to improve anything. It doesn't make anything better. It's a waste of time. You'd be much better off just browbeating the other Republicans into funding your friggin' wall or something like that. I don't know what Trump's doing with this one, actually. I'm a little bit astonished that he's choosing to put so much of his time and effort into something that was honestly secondary. The only primary goal that a lot of his fans had in mind when he talked about it at all and gave him a standing ovation when he did, the only major thing they wanted was the repeal of the ACA. The replace part didn't get people excited. Getting rid of Obamacare got them excited. Some of those people, they saw their cost significantly rise. They kicked off some plan, had to get a different one. Maybe they're paying twice as much. Maybe they're paying the same amount but getting half the coverage. Maybe they had to switch doctors and they had their doctor for 20, 30 years. Yeah, no wonder it was unpopular. It was even unpopular with some Democrats. Why do you think the Rust Belt went red? A lot of those middle-class Democrats that all of a sudden couldn't get the right plan for them. They're like, well, I like my plan. Why the hell, why did the government suddenly and arbitrarily determine it was a bad thing? Because it doesn't cover some obscure condition that the government thinks it needs to cover. What we need is less government and health care. What we should do is do away with health insurance altogether, just abolish it altogether. Figure out ways to drop the cost of coverage to a reasonable level so that we can just subsidize people who are poor. Why don't we just do that? It'd be so much easier. Give them a direct subsidy to go get care. Everyone else, they'll have no problem paying for it because it'll be cheaper. That's what we should be doing, not dicking around about how many thousands of pages of legal patches we need on layer after layer after layer of big government healthcare. We don't need big government healthcare. And Trump spoke to this on the campaign trail. That would be a promise broken. He's saying, oh, well, we're not going to let the poor fall through the cracks, but the ACA has significant problems. We're going to get rid of it, and we're going to replace it. Repeal and replace turned into reform, which was predictable. But it doesn't look like the Republicans in the Senate really want to reform it. Looks like they're actually on board with it. Oh, the pharma companies, all of a sudden they're paying us money because we're the ones in power. Oh, maybe we have to think twice about whether we don't like the ACA. Maybe we have to think twice about whether we want the peons to be able to get their so-called junk plans back. The government labeling something a junk plan doesn't make it junk. Any more than the government labeling anything else under the sun makes it so in a unilateral fashion. The government loves to do things like that. It's dumb. Trump should be doing something more worth his time. You know, look at North Korea right now and the problems diplomatically that we've got there. You're worried about reforming the ACA with the AHCA. What's in it? I'd like to know before, Congress actually starts voting on it. It'd be nice if the citizens of the United States who have to deal with those health insurance systems, be nice if they got a chance to see what's in it. And if Trump wanted to really ingratiate himself, by the way, not just to the Republicans, but to every centrist in the country, he'd come out and say that. He'd say, yes, I too am slightly concerned here, and I might have to veto the result if they don't let people see what's actually in it. Oh, he'd score so many points with the American people if he did that. It's like he's bypassing a huge gift. The never-Trumpers are handing him a gift right now, and he's not actually taking it. I don't quite understand what he's thinking with that. He did come out and say something to the effect of the healthcare plan sounded mean before, and people were mystified about what he meant by that. Has he read it? Like, is it so top secret that even the president can't look at it? Because I know Rand was running all over the place trying to read elements of what would become healthcare reform. He couldn't get in to look at it either. Like, you got to have a day pass from the manager of the CIA and the CEO of GlaxoSmithKline in order to look at the AHCA, I guess. It's even more ironclad than the ACA was. At least then people got a basic gist of what was going to be in it, whether they agreed with the content or not, and then, of course, Obama had lied about some of it. And this looks like it's not going to be a reform at all. Looks like a waste of time, just like Ryan Care was. Now, though, people are going to call it Trump care. Trump needs to be a bit concerned about this, I would think, when you think about it. Before, he could just sort of put Ryan in front of the firing squad, say, okay, Paul, it's your health care bill now. I refuse to support it. Ha ha. He must have laughed about that. But Paul Ryan can't really take the fall this time around. What's he going to do? Is a Lindsey Graham care, of John McCain care? Like, he's going to purposely sabotage it and then say, oh, don't blame me. It was John McCain's idea. Vote him out of office. He's senile. He doesn't know what he's doing. And while that would be hilarious to me, I don't think it's going to work. Trump's going to end up owning whatever the result is, and he would be well warned. It's not a great idea. You should veto it in its current form because nobody knows what's in it. Nobody knows what's in it, which just leads people to speculate that the Democrats are right when they say it's going to be a disaster. What's the point? That's about all. Peace out.